I'm here now. My name is Emmy Butcher. I'm the practice manager at Beversbrook Medical Centre in Calne. It's reported that 1 in 5 adults in Britain are smokers. Don't worry, I've not come to the wrong meeting here, so do bear with me. I read recently that in the 2010-11 financial year, the UK government invested over £80 million on smoking cessation. In primary care, we support quitters via clinics, there's training for staff members, and we're measured on our achievement. Of course, all of this support makes sense, because we all know that smoking kills. The cost to the NHS is estimated to be around £5 billion per year treating smoking-related illnesses. In contrast, it is reported that 1 in 8 adults are carers. Social services and the NHS rely on carers' willingness and ability to provide care, which is worth an estimated £114 billion per year. In addition, over 600,000 patients in the UK suffer mental and physical ill health as a direct consequence of the stress and physical demands of caring. This is quite a hefty bill, especially for us in primary care now we've taken over the budget. Aside from having a carers register and a carers protocol, which is included in QOF, I wonder how much support we offer carers in our practices. I believe, is it as much, ask yourselves, is it as much as you offer smokers or anybody else on any other register? I believe one of the main problems faced by practices in supporting carers is knowing how to go about it. Where do you start, and what exactly is it that carers want? I believe the GP Carers Awards provides practices with an easy step-by-step guide to implementing small changes which have a big impact on supporting carers' needs. How does it compare with supporting other patient groups, such as smoking cessation patients? When we first met with carer support, the Beversbrook team were already feeling that we were simply not offering enough support to our patient carers. For example, we would encourage patients to sign up for our carers register, but didn't really know how best to help them other than pointing them in the direction of other agencies. We met with Helen in 2007, who introduced the possibility of offering carers clinics. Back then, this was a revolutionary notion, but came as a breath of fresh air, but not without some concerns. We hadn't worked with an outside agency to this extent before, and there was a certain level of doubt over how successful the clinics would be. One of the biggest worries was whether or not people would turn up, and if they did, would it be worth their while? The clinic consists of a 10-minute one-to-one with our nurse, which is a good opportunity to see patients who wouldn't normally come to routine checkups, a good pick-up for QOF. A one-to-one from care support follows, and finally an opportunity to sort out financial entitlements with somebody from the CAB. The financial aspect is important, as it's clear from our own experience that when patients have financial worries or coping anxiety problems, it can often lead to health issues. By offering these clinics, we wanted to prevent patients reaching a crisis point, which often means a greater involvement of primary and secondary care resources. It seems simple in theory, everything to help and assist our carers in one place, a one-stop shop. But what was it going to be like in practice? Well, thankfully, the first clinic in June 2008 was more successful than we could have ever hoped for, and we now run these clinics biannually. After each clinic, carer support provided us with a clinic evaluation. I can confidently say that everyone has been tremendously successful. The responses that we have received from patients has been very positive, and I feel confident in saying that no appointment is wasted. No appointment wasted. How many clinics can boast that? Every patient who's made an appointment has found a benefit from attending, whether this be financial, health-related, or just needing someone to talk to and to offer support. Over the past 4 years, we've improved the clinics, providing a separate waiting room for attendees and also increasing the number of support workers. I would recommend holding carers clinics, but understand that they don't work for everyone, for every practice. However, the benefits we've found to our practice has been immense. Working with carer support FAB, they used to be the financial people, and now CAB, has proven that more can be achieved when pooling resources. Not only are we offering a better service for our patients, but the impact on the practice is very minimal. For example, no doctor time is needed to run these clinics, which is obviously, as we all know, the most in-demand resource of any GP practice, and sometimes the hardest to engage. The effort put into organising the clinics outweighs the benefits and is little more than sending out invitations to our carers on our register and then booking appointments for them when they call in to make them. The dedication of 2 nurse clinics a year is pretty much the only real cost. No extra funding is required, no big financial implications. The main commitment comes from the ongoing clinics from carer support and the CAB assistants, who really are the main draw for patients and offer the most valuable part of the clinic. There is no strain on reception, as patients are able to choose their own appointment time, and due to this, very little, if any, DNA rate. In particular, we found that by promoting the clinics and getting more involved with our carers, we have helped to raise awareness within the practice. Not only amongst our patients, but more importantly with our staff members. Last year, we obtained a grant from Skills for Care, and Helen came along and trained all our clinical and non-clinical staff on carer awareness. This training had a tremendous impact on our staff and gave them a real insight into the lives and challenges facing carers, and how small changes, even in attitude, can have a big impact on supporting carers' needs. I think in reception, it particularly hit home with our receptionists. Supporting the awards by providing a dedicated space for posters, assigning a non-clinical member of staff as carers lead, or even offering a carers clinic once a year will bring minimal disruption to your practice, but will show your patients who are carers that you care in your practice. One of our doctors recently stated that he felt this was the most important aspect of supporting carers. The fact is that they will continue to care for their loved ones regardless of what practices do. But by having the security of knowing that this group of patients are supported if and when they need it, provides comfort and a good working relationship with the practice. Believe it or not, despite everything we do to promote it, Beversbrook still have a relatively low percentage of our patient population who've signed up for our carers register. Often you will find that carers won't engage. They don't want to be a burden, which is why it's more important for us to introduce subtle changes, such as these suggested by the GP Carers Awards, almost like stealth. This will help us to promote a better service for carers in primary care. I'm happy to answer any questions at the end.